Today we will be discussing opioids. There are three different types: natural, semi-synthetic, and fully synthetic.
Natural opioids are considered alkaloids, nitrogen-containing base chemical compounds that occur in plants, such as the opium poppy. Some examples of natural opioids include morphine and codeine.
Some synthetic opioids are synthesized in labs from natural opioids, such as morphine and codeine, and can produce opioids including heroin, oxycodone, hydrocodone, and hydromorphine as forms of semi-natural opioids.
Fully synthetic opioids are also created in labs, and they are most frequently used by cutting drugs with or without the user's knowledge. The most common fully synthetic form of opioids is fentanyl. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine.
Certain opioids are considered prescription opioids, such as morphine, codeine, and oxycontin, which are provided to patients to treat pain. However, opioids produce a high, which causes many people to abuse them.
Opioids affect the opioid receptors in the brain, spinal cord, and other parts of the body by binding to these receptors. The binding to these receptors diminishes the perception of pain and causes feelings of euphoria, but also includes side effects like nausea, confusion, and drowsiness.
Doctors have certain guidelines for prescribing opioids, such as checking the Prescription Drug Monitoring Program, PDMP, for high dosages and prescriptions from other providers. And if prescribed, your doctor should evaluate the benefits and the harms of continued therapy with patients about every 3 months or more frequently.
It is important when prescribed opioids to start at a low dose and to slowly increase the dosage if needed to avoid opioid dependency.
Before even starting, your doctor should discuss with you the known risks and realistic benefits of opioid therapy, and should establish treatment goals to measure for pain and function. And should consider how opioid therapy will be discontinued if benefits do not outweigh the risks.
For more information on opioid prescription use and proper dosages, please visit the CDC website.
People between the ages of 18 and 25 are most likely to abuse opioids for non-medical reasons. These reasons include easy access to receiving a high and because they believe it could help them focus, to work, or study better.
In 2017, Ohio had the second highest rate of drug overdose deaths involving opioids in the U.S. There were 4,293 reported deaths, a rate of 39.2 deaths per 100,000 persons, compared to the national average of 14.6 deaths per 100,000 persons. The rate of overdose deaths involving opioid prescriptions rose steadily from 0.7 deaths per 100,000 persons in 1999 to a peak of 8.4 deaths per 100,000 people in 2017.
There have been 3 distinct waves of opioid deaths in the United States. The first wave began in the 1990s due to medical professionals increasing the amount of prescribed natural and synthetic opioids.
The second wave of opioid deaths began in 2010 with the rising of heroin and its fatality. Heroin is an illegal opioid often used as a street substitute for addictions derived from medically prescribed opioids.
The third wave began in 2013 with significant increases in overdose deaths involving synthetic opioids, particularly those involving illicitly manufactured fentanyl, or IMF. The IMF market continues to change, and IMF can be found in combination with heroin, counterfeit pills, and cocaine.
Pill mill is a term to understand when being educated on opioids. Pill mills are facilities that sell opioids just to profit. They usually use cash so that they will not be tracked by government agencies like the Drug Enforcement Administration, and they usually overprescribe opioids. Shutting down pill mills is a key that will decrease the opioid epidemic.
Narcan is the overdose antidote to opioids and is carried by law enforcement in some locations, can be contained by individuals in the scenario of them encountering an overdose.